on Thursday, WWAY and Novant Health, New Hanover Regional Medical Center, are partnering for our annual health fair at Independence Mall. All this week, we will be chatting with some of the doctors at Novant Health about some of the healthcare services in our area. Tonight, Dr. Benjamin Browning is here with me from Novant Health Orthopedics and Sports Medicine in Brunswick County. Thank you so much for being here.
Thanks for having me.
So I know you specialize in sports medicine, which almost brings to mind an image of elite athletes, but I know it's much more than that. So talk about what exactly sports medicine entails.
Okay. Yeah, well, it certainly includes those elite athletes, as you mentioned, but really just any active individual, regardless of activity level, both athletes and non-athletes. Just people who want to be more active and both in the diagnosis, treatment, and prevention of any of those injuries. So
you don't have to be an elite athlete to get a sports injury.
Certainly not.
So
we get quite a few from non-elite athletes.
Good to know. So what are some of the common sports-related injuries that we're talking about?
In my practice, really just a lot of shoulder and knee injuries. Rotator cuff tears, meniscus tears, cartilage injuries to the knee, but even just regular muscle strains, flare-ups of arthritis, your normal wear and tear type things.
So what point do you need to go see somebody about an injury that you think may be sports related?
It's normal to get out there and feel a little bit of muscle soreness after any sort of activity, but anything that's persisting, for multiple days, if you're trying to use the usual RICE method of rest, ice, compression, elevation, and you have some sort of injury that's preventing you from really getting back out to the level that you want to, or keeping you from really just doing it as often as you'd like, those are certainly good reasons to get in and get it checked out by a sports medicine doctor. And
that's really good to know. So what are some of the common treatments for these injuries?
Certainly, always a good role for non-operative treatment, whether that just be, as I was saying, rest, ice, compression. If anti-inflammatories aren't working, then physical therapy plus or minus some injections. When all that is just not really getting you to the point that you want to be at, then there's certainly sometimes a role for surgery or for certain conditions, surgery early on.
And we don't always want to see that, but sometimes it's the best option.
Yeah.
So do you have any advice for people to avoid injuries when they're playing sports?
Yeah. If you're looking to start a new activity or a new sport, it's always a good idea to get in and do some activity-specific exercises in the gym. If you're not sure what that really entails, then getting in so we can get you in with a physical therapist just to be able to give you a good activity-specific exercise program, work on a range of motion and strengthening for some exercises specific to that sport that you want to play.
All right. And will you guys have someone at the health fair offering services?
Yeah. At the health fair, they'll be doing a lot of preventive health screenings, providing some health education, and really connecting all of them with resources that they need, whether it be primary care or subspecialty care.
Perfect. Thank you so much for being here, Dr. Browning. And again, the health fair is on Thursday, happening at Independence Mall from 12 to 4 p.m. Be sure to come out and see us and check out all of the vendors.